Okay, we just started recording.
Welcome to those who are coming on. We're going to wait a couple minutes for more people to join, and we'll be starting shortly. Thanks so much for coming on tonight. Welcome again to those who have just signed on. We're going to start shortly. We're just waiting for other folks to get on with us. Some people are needing to use the phone instead of the video, so we're sharing additional information to people, and we'll be back with you in just a quick second. Welcome, everyone. Thank you so much for joining tonight's Moms Rising webinar titled COVID-19 Support Programs, All You Need to Know and How to Apply. I'm Kristen Ralphing-Feiner, Executive Director and co-founder of Moms Rising. And for those of you who are new to our community, welcome. Moms Rising is an on-the-ground and online organization of over 1 million people working to increase family economic security, to decrease discrimination, and to build a nation where everyone, absolutely everyone, can thrive. During this incredibly difficult time, we've been hearing from thousands and thousands of you from across the country. And so this webinar has grown out of your stories, your challenges, and your contributions that you've been sharing with Moms Rising and with our communities. We hope that this evening brings you lots and lots of useful information and tips about your rights and about how your family can access much needed support during this pandemic, as well as brings you together in community with one another. People from all over the country have signed up to be on this together tonight, and we are loving seeing all of the names of the cities and the states in the chat box. If you're on video or if you're on with us on Zoom, feel free to put your name or just your city and your state in the chat box to let other folks know you're here and where you are. And Moms Rising has members in every state in the nation. So we're so excited to see so many states represented. As we're on tonight and after we close out, after we leave, I want everyone to know that we're in this together and that you are not alone. We are here for you, and also we're here for one another. So thank you again for being with us tonight and into the future. Now I'm going to turn the mic over to Donna Norton, Moms Rising's Executive Vice President. Welcome, Donna.
Thank you, and hi, everybody. Tonight you're going to hear from a number of experts on the programs newly passed by Congress to address the coronavirus and how you can access the programs, including paid sick days and paid family leave, unemployment insurance, nutrition assistance, and the impacts of these programs on immigrant families. Joining Moms Rising tonight are experts from the National Employment Law Project, CLASP, Food and Research Action Center, and the National Immigration Law Center. Thank you so much to our amazing partners for providing us with information, guidance, and community during this difficult time. And now you're going to hear from Alyssa Schmier, our fantastic National Director on Budget and Taxes, who will be emceeing this webinar. Thank you, Alyssa.
Hey everyone, I'm going to go over a couple of quick housekeeping tips. We have a lot to cover and are planning for this webinar to last about 1.5 hours, but if it's going well, we're going to let the conversation flow and go slightly over time. If you have to jump offline, it's totally okay. This meeting is being recorded, and we'll email you the recording as well as a resource page in the coming days, so you can come back anytime and watch what you've missed and also share it with your friends and family. We have a live translation in Spanish right now. So to access that translation while you watch this Zoom line, you can call the phone number 510-401-1495, and I'm going to drop that into the chat right now. I think they're still getting that up and running a little bit, but that will be the Spanish translation. Just remember to mute your line if you join that. If you're not familiar with Zoom, here's a few brief instructions. Look at the bottom of the Zoom page. You'll see a function called chat. Click that and a chat window should appear on the right side of your screen. During the program at any time, if you have any thoughts or questions, please feel free to type it in the chat box. We'll be monitoring the chat box closely, and we'll do our best to get to everyone's questions. But if we don't get to your question because of time constraints, we'll do our best to answer them in the email after the webinar. You also can ask any unanswered questions to keepmarching@MomsRising.org, and we'll drop that email address into the chat box as well. And remember, we probably can't see you because we turned off all the cameras and everyone's muted, but it's just as a reminder, don't do anything on Zoom that you wouldn't want to be caught on camera. It's just a general reminder. So first, I'm happy to introduce our first speaker, Michelle Evermore from the National Employment Law Project. Michelle is going to be discussing a new unemployment information about the new unemployment insurance programs. Thank you, Michelle.
Thank you so much for having me. I'm so excited to be able to talk to Moms Rising and work with all of the great advocates on the line here. It's really an honor. Thanks for letting me speak to you. There are several different components to this, and it's really complicated. So I'm going to try and go slow and leave room for questions at the end. So the second COVID bill that passed, Families First, that included $1 billion for states to administer all the new claims that were coming in. Unemployment Insurance Administration is actually funded based on last year's unemployment rate. And last year's unemployment rate was very, very low. So states had to process this huge crush of claims. And that's sort of why you're seeing all of these backlogs right now. 500 million of it just automatically went to states. The other 500 million, this is important to keep it to know about. It's tied to states waiving work search requirements, waiving what's called experience rating. So this is how employers are charged the more workers that work for them get unemployment insurance. By waiving that charge, you're actually waiving their incentive to challenge claims. So that claims can move more quickly. And it also waived waiting weeks. So the day you become employed, you're eligible to start receiving benefits. The second bill that passed had 3 major programs in it. The first one is called Pandemic Unemployment Assistance. This is a program that's parallel to unemployment insurance. but it's available to people who wouldn't qualify for regular unemployment insurance, such as independent contractors or people who are self-employed or people who are unfortunately misclassified in their state as independent contractors. This is fully federally funded, 39 weeks of base benefits. It's calculated the same as the regular unemployment insurance benefit, except there's a minimum benefit of half of the average weekly benefit paid in the state. So this is based on disaster unemployment assistance. So states actually do have experience processing something like this, but it's taking them a while to get up and running. And it's a much broader definition of who qualifies. You can qualify for pandemic unemployment assistance if you've been diagnosed with COVID, a member of your household has, you're providing care for somebody who has, you're providing care for a child who can't attend school or work because of COVID-19. You're quarantined, you were scheduled to start employment, but you can't because because that employment was canceled. You have become the breadwinner for a household because the head of household has died as a result of COVID-19. You had to quit your job as a result of COVID-19, or your place of employment is closed as a direct result of COVID-19. This is a little bit more challenging to administer. Only 5 states have really, that I've seen so far, have really started paying out, processing this benefit. Paying out this benefit's going to take a little bit longer than usual. And that's because regular unemployment insurance, when you're a W-2 worker, your employer is actually providing information to the agency about what you earn and who you are, right? And so when you become unemployed, the agency already has a lot of information about you. For somebody who wouldn't qualify for regular UI, they don't have any information about you, so they have to establish your eligibility from scratch. So it takes a little bit longer. The second piece of the CARES Act is pandemic unemployment compensation. This is $600 per week added to any kind of unemployment benefit you get. If it's partial unemployment, which means your hours were dramatically reduced and you still apply, you still qualify for a little bit of unemployment insurance, you get the 600. It's added to regular unemployment insurance. It's added to pandemic unemployment insurance. Anyone not getting a benefit qualifies. And this is $600 per week. It expires July 31, 2020. And then the third piece of the CARES Act is the Pandemic Emergency Unemployment Compensation. This is 13 weeks of additional regular unemployment insurance. And this is all still fully federally funded. And every state, whether the state already has 26 weeks of benefits or 12 weeks of benefits, the benefit duration varies in states. Every single state gets an additional 13 weeks. And then there are provisions about short-time compensation, or what's referred to as work sharing. Work sharing is an amazing tool for employers to manage layoffs, to spread hours across the workforce and retain all their employees. States with a program in place to do this, 27 states have a program in place to do this. They'll get, those benefits will be 100% federally funded. States, the other states that don't have a system like this up and running can set one up temporarily and still get 50% federal funding. And again, so for all of these new benefits, this sounds like it's inside baseball, but all of the administration associated with them are also federally funded. So it should, although we're seeing a massive glut in claims now, funds will start flowing, benefits will start moving pretty shortly. There's a couple other little clauses in this legislation. One is that if a state agrees to take this money, they cannot cut benefits until the program is over. The first week, the waiting week, is fully federally funded. And then nonprofits and municipalities, any sort of government entity, sometimes they elect not to pay unemployment insurance taxes, and in exchange, they pay whenever one of their workers claims benefits, they just pay the whole benefit. Those entities, those nonprofits and those government entities will be partially reimbursed. Now, 50% of that cost will be refunded to them. So that's all important. But what I want to really talk about tonight is there's nothing permanent in this legislation. So state unemployment insurance programs they all have wide discretion about how they can pay benefits, how much those benefits are, how long you can get them, who can get them. And states, since the last Great Recession, going into the recession, states spent all of their trust fund money. And so then when the recession was over, they found themselves without money. And there's two ways to refill the trust fund. One is by taxing employers, and the other is by cutting benefits. A number of states chose to cut benefits. So that's why you're seeing in states like Florida, really slow processing times, people having to go back to paper applications. I saw a line of people outside the unemployment insurance agency in Florida, not properly distanced, getting these paper claims. And there's no funding in here to shore up state trust funds, and states are going to need more money. The other thing you might have heard about unemployment insurance is that they're running on very old computers. Only 16 states have modernized their computers, which means the rest are running on 1970s COBOL mainframes. So states need more money to set up good computers to process their benefits. The good news is, state UI directors knew that a recession was coming. Many developed plans. Nobody expected to have to gear up this quickly. But there are many states with many thoughtful plans. I have confidence that people will receive this benefit. I'm going to preemptively answer a couple of questions that I get a lot of, because I know they're probably all on your mind. The first question I get is, I have this circumstance. Can I apply? No matter what your circumstance is, you can apply. You might not get a benefit, but anybody who becomes involuntarily unemployed in this climate should absolutely apply for unemployment insurance. Last year, 74% of people who became unemployed didn't apply for unemployment insurance. And most of those didn't apply because they decided they probably wouldn't get it. That is not your determination to make. You're leaving a lot of money on the table by deciding that maybe you won't qualify. So to everybody who asks, even if I think that they might be in a circumstance where they won't qualify, that's not up to me. That's up to your UI agency. And the other question that I get asked a lot of is, what happens if this runs out of money, like the PPP program, like the small business assistance? Unemployment insurance has to pay benefits. If you're entitled to a benefit, that's an earned benefit. So they have to pay you. If the state trust fund runs out of money, they can borrow from the feds. If the feds run out of money, Congress will have to appropriate more. Everybody who is entitled to a benefit should get it. So with that, I will turn it back over and leave some room for questions.
Yeah, so again, people can put their questions in the chat box or in the Q&A box, and we are going to do our best to answer them. We have about 5 minutes to answer questions, so I'm just going to throw a couple out to you, Michelle, that we received from folks. So I think that there's been a couple of questions about the $600 that people are getting. So people are saying, like, would you only get the $600 bonus? If you qualify for unemployment benefits, would you receive this if you have been getting UI prior to when that went into effect? So basically, if you were getting unemployment benefits and received benefits prior to, like, when quarantine went into effect, are you eligible for that $600 as well?
Anybody getting any kind of employment assistance is eligible for the $600. And here's where I want to make a point about what's called monetary eligibility. So a lot of people don't end up qualifying for unemployment insurance because they didn't make enough money, but you can get the pandemic unemployment assistance if you can demonstrate some kind of attachment to work, and that attachment to work can be, I just graduated from college, I got offered a job, and then COVID hit, and then I couldn't start that new job. That's enough attachment to the workforce to qualify you for the minimum pandemic unemployment assistance benefit. So if you get $1 in unemployment, you'll get the $600 from any program, whether you've been receiving UI for a while or whether you're just establishing a benefit. The other thing I want to point out is that since the pandemic unemployment assistance program is brand new, benefits, people were unemployed but will be eligible for a PUA before the program was up and running. That's okay. You can get paid all the way back to the day that you became unemployed. It's retroactive.
And then we got a bunch of questions about people whose hours were reduced, but maybe they weren't laid off completely. So would those people be able to get unemployment insurance in any way?
In many cases, yes. There's something called partial unemployment insurance. And if your pay was reduced below whatever your average weekly benefit would be, you can get some of that income replaced with a regular unemployment insurance benefit. And even if it's $25, you're still going to get the $600 a week. So if your hours were dramatically reduced, apply for unemployment insurance.
Then Maureen just asked, she works per diem in a healthcare facility. She's not working due to COVID, but she's not technically, laid off or unemployed. So again, I think it's one of those things where you're not technically furloughed or unemployed, but you're not able to pick up any hours. So would that be a PUA?
Yeah, so it really, from the perspective of unemployment insurance, it doesn't matter what your employer calls it. If you're involuntarily not going to work, then you're unemployed for the purposes of unemployment insurance.
Great. Okay. And then I'm just going to answer one more question. And for those of you that we're getting a lot of questions about immigration status and unemployment. So I'm going to actually hold that for Jackie because I think she's going to be covering the ins and outs of that. But we got one more question from Stasia. She says that she's on standby and her employer has offered her a job at a reduced pay rate from her previous employment. And that's not going to start for like another month or so. So does she have to take that job or she'll lose her unemployment benefits? Basically, if you have an offer on the table, but it's not a desirable offer because it's either puts you at risk or it's a lower salary than you're able to take, do you have to take a job if it's offered to you?
Every state requires that if you're offered suitable work, you have to take that or you'll lose your benefits. So if you were offered the exact same job at the exact same pay that you used to have, you would be obligated to take that. If you're offered a job with significantly reduced pay, that generally doesn't qualify as suitable work. But I would check with the state agency because one of those things, when I was talking about how states were cutting benefits in the past, one of the things that states were doing is lowering the standard for what a suitable replacement job is. And so that's why we still have a lot of work left to do on unemployment insurance because the administration is really uneven throughout states.
And then I'm going to wrap up, but just one more quick question about, do you just have any general advice from people who are dealing with phone lines and websites crashing, and the frustration of how long it possibly could take to even get your paperwork considered, let alone the checks start flowing?
Yeah, I mean, my first piece of advice, if you ignore everything else I say, when you try to apply for unemployment insurance, keep your password. Do not lose your password because in a lot of states, if you lose your password, you can't reset it the same way that you can with your bank or any other institution. You have to actually call them and somebody has to reset it. And sometimes in some states, when they reset that password, they'll send it to you through the mail. That's the last thing you want right now. So first, save your password. Second, it's going to take a while, but states just got that $1 billion just over a week ago. So they're still staffing up and they will be staffing up. and there will be more people and there will be more systems online, and states are setting up more computers and more phone lines. So be patient, stick with it. This is a benefit that you've earned, and just don't give up.
Great. And we're going to answer the rest of these questions because I know you guys had a lot of questions. We'll try and do our best to do it after the call. But remember, keep your password. Don't lose your password, because I have family members that lost their password and it's a pain. So thank you so much, Michelle. So our next speaker is Pranita Gupta from CLASP. Pranita will be discussing the expanded paid sick days and paid leave programs.
Thanks so much. Can you hear me?
We can.
Great. I'm going to share my screen. Oops. Sorry, needed this technology. Great. So I just also want to thank Moms Rising for inviting me to participate in tonight's webinar. We have worked for many years with Moms Rising to pass national comprehensive and inclusive paid leave policies. So we were really hopeful when, in response to this historic public health and economic emergency, the original version of the Families First Coronavirus Response Act was a far-reaching bill that would have created a permanent paid sick days and paid family medical leave program that so many workers with low incomes urgently need. This legislation would have covered most workers in the US. And as you all know, paid sick days and paid family medical leave are critical supports that keep workers, especially with low wages, connected to work when a critical health crisis or need arises. No one should really have to make the untenable decision between caring for their own health or the health of a loved one and their economic security. So we were really disappointed when the final version of the Families First Coronavirus Response Act that was signed into law really was a stripped down version of the original bill, and that the permanent programs were removed and only the emergency paid sick leave and a narrow emergency paid family leave provision were included, thereby leaving millions of low-wage workers out of these critical programs during a national pandemic. Altogether, this bill is an important first step, since it's the first time Congress has required federal paid leave for private sector workers. So here are the key provisions. So for the emergency paid sick leave, the Act requires workers to be provided up to 10 days of paid leave for the coronavirus pandemic, which started April 1st and is in effect until December 31st, 2020. It provides, so workers are eligible for this leave if they are subject to a government mandated quarantine or isolation order, if their health provider orders self-isolation due to concerns related to COVID-19, they're experiencing symptoms of COVID-19 and are seeking medical diagnosis, they're caring for somebody who's subject to a quarantine or isolation order, they're caring for their child whose school or place of care is closed or whose childcare provider is unavailable. Or they're experiencing something that's very vague called a substantially similar condition as specified by the Departments of Health and Human Services in conjunction with the Department of Labor and Treasury. So when a worker needs to take paid sick days, the Act provides full wage replacement if the worker takes it for their own care, but limits it to 2/3 wage replacement if the employee is caring for another person or child. So this reduced wage can really make it difficult for workers who only make the minimum wage from being able to afford to take this leave. And so as you can see, full wage replacement for self-care would go up to a maximum required benefit of $511 a day, or a total of $5,110. For 2/3 wage replacement, if employees are caring for another individual or a child whose school has closed or whose childcare provider is unavailable, would have a maximum required benefit of $200 a day, or $2,000 total. Employers pay employees. That's how it will work. So you don't have to apply to a government agency. You just go to your employer, and the employer will pay the employee for this time, and the employer will get reimbursed by the federal government through tax credits. So who's eligible? This emergency paid sick days provision covers public employees and private sector employees working for employers with less than 500 employees. It covers full-time and part-time workers, and self-employed workers are also eligible for tax credits. Who's excluded? It excludes workers who work for an employer with 500 or more employees, including large restaurants and retail establishments. It also allows employers of healthcare providers and emergency responders, workers who are really on the front lines of the pandemic, to opt out. And the US Department of Labor has really broadly defined these terms in their guidance on these policies. Lastly, the Department of Labor can also exempt private employers with less than 50 employees from providing leave to care for a child whose school or place of care is closed or whose childcare provider is unavailable, if it risks putting them out of business. Again, our concern is that the Department of Labor is really interpreting this very broadly. It's important to note that there is no immigration status related restriction in this program, which is good for immigrant workers. So for the Emergency Family Medical Leave Act expansion, this act temporarily provides up to 12 weeks of paid family medical leave during this health emergency. However, this expansion is very limited. It's only available for employees unable to work or telework because they are caring for a son or daughter whose school or place of care is closed or whose childcare provider is unavailable. And son or daughter is defined as including a biological, adopted, or foster child, stepchild, legal ward, or a child for whom you are standing in loco parentis, someone with day-to-day responsibilities to care for or financially support a child. It also includes, which we're happy that the Department of Labor interpreted it this way, it also includes an adult son or daughter who has a mental or physical disability and is incapable of self-care because of that disability. Again, it provides the first 10 days of leave may be unpaid, although employees may be eligible for paid sick leave during this time. After 10 days, employees must receive 2/3 of their regular wages for the remaining 10 weeks. However, this may create a financial hardship again for the lowest wage earners. Like the paid sick days provision, employers pay employees and can be reimbursed by the federal government, and self-employed workers are also eligible for tax credits. This program's really went into effect starting March 18, and it goes through December 31st, 2020. So again, who's eligible? Employees must be employed at least 30 days, but don't have to meet other FMLA eligibility requirements that currently exist in the full Family Medical Leave Act. So it also includes employees who had worked 30 days in the prior 2 months, were laid off after March 30th, but then rehired. So those workers are also covered. Who's excluded? This provision also excludes employers with 500 or more employees and the majority of federal employees. It allows employers of healthcare providers and emergency responders to opt out again. And again, the Department of Labor has broadly defined these terms. DOL can again exempt businesses with less than 50 employees if providing emergency paid leave to specific employees puts them out of business. And of course, it excludes all other forms of longer term leave needed for self-healing or to care for a loved one impacted by COVID-19. It also doesn't guarantee job protection for employers with less than 25 employees, meaning these workers can lose their job by taking this leave. Again, it's important to note that there are no immigration status related restrictions in this provision either. So on this slide, I just share some additional resource information if you want to learn more about, there's some really good FAQs available from the Wage and Hour Division, as well as guidance. And if you have questions and concerns, here are the numbers you can contact. If your employer is improperly refusing you paid leave, you can contact the Department of Labor. It's also really important to note that neither the emergency paid sick days or paid family medical leave policies passed under the Families First law diminishes a worker's right under existing state or local laws or existing employer policies. If a worker isn't covered by the emergency federal policies, they may still be covered by a paid sick days law in the 12 states and 22 localities that have passed these laws, or by the 8 states and the District of Columbia that have passed paid family medical leave laws. Many of these jurisdictions with paid sick days laws have already covered public health as and other emergencies in the context of their law. But some jurisdictions have also passed temporary legislation or expanded their existing laws to cover this at this time. And due to the shortcomings in the federal policies, a number of states and localities have passed temporary measures to cover many of the workers excluded under the national law. So again, these are the core elements of the Families First emergency paid sick leave and family leave policies. And I'm happy to answer any questions you may have.
Yeah, thank you so much. That was great. So a couple of people have asked, like, what can you take, depending on, what can you take and what can't you take together? So can you get FMLA expansion and sick leave and then take partial unemployment? Can you get unpaid leave? If you have unpaid leave, can you still get unemployment insurance? Basically, what is the interaction? Is it a one or the other type of thing? Or can you kind of cobble these together to get to the point where you're supporting your family?
So, and I'll let, hopefully, I'm glad that Michelle's still on because she might be able to help me with this a little bit. So there is a certain level of sequencing you can do. For example, if you fit under the eligibility requirements for the emergency paid sick leave, you can take that emergency paid sick leave. Again, those are 10 days of leave that you're entitled to. And after those 10 days, if you continue to have a need because your son or daughter's childcare provider is no longer available, or school still hasn't, their school or place of care is still closed, you can then apply for the emergency paid leave provision. So that's how you can sequence those two important provisions. However, if you have lost your job, and these are some of the challenges, if your employer decides that you don't have work to do at this time, you may not qualify for either the paid sick leave or the paid family leave, in which case you may have to turn to either the pandemic unemployment assistance program or the unemployment insurance program. So that is one of the cases where if your employer has furloughed you, or your employer has decided that they've gone out of business, or they have no work for you to do during this time. And we've been seeing examples of this where workers who work in like a bakery or a flower shop or someplace, and their shop is closed at this time, their employer may not have work for them to do, and may decide that they don't qualify for the emergency paid sick leave. So at that point, they may have to again, turn to the unemployment insurance system. I don't know, Michelle, if you have more you'd like to add.
Yeah, I would just add that in order to qualify for unemployment insurance, either pandemic unemployment assistance or regular unemployment insurance, you have to run through every other kind of benefit that you're entitled to and any other sort of paid leave that you may have access to.
And yes, I just want to say thank you, Michelle. Like, again, these are paid leave and pandemic unemployment assistance are very different programs, and they are not substitutes for each other.
Great. Edgar had a great question that he's gotten from new retail and grocery workers. He said, to qualify for emergency paid leave, sick or family, are workers required to have worked a certain number of days, hours in order to qualify? So like if you've been on the job for a month, a week, are you able to access?
No, thank you for that. No, for the emergency paid sick leave, there are no requirements like that. You should be able to get that immediately. Again, if you meet all the requirements that I laid out, you know, that you're subject to a government mandated quarantine or isolation order, and or you're experiencing symptoms, or you're caring for someone. If you meet all those, you should be able to be covered. Now, the concern is that many grocery workers and others may be exempted because their employer is going to the Department of Labor and claiming that they're essential services. And since the Department of Labor's guidance is very broad at this time, they may be interpreting, so some employers may be able to say their workers don't qualify for this leave, even if they are sick. So what I would recommend is, if somebody is, they should first go and request this leave from their employer. If they are denied this leave from their employer, they should contact the Wage and Hour Division in the U.S. Department of Labor and let them know. And they should also look and see if their state offers paid sick days, because again, many of the states are trying to cover those workers who have been left out by the federal policy and the loopholes in the federal policy.
Great. So Stephanie wrote, since my employer gave me two options, voluntary unpaid leave or resign, before the stay-at-home order in Tennessee, would I be eligible for tax emergency paid leave or any sort of tax credits?
So voluntary unpaid leave or
resign.
Or to resign, but they are still employed?
Well, they were given those two choices.
So if they are still employed by their employer, they can't, the only way you can really get the tax credit, in my understanding of it, is if you are self-employed. So if you were self-employed, then you are able to get those tax credits, but the tax credits go to your employer if they are providing you with paid sick days. Otherwise, they would probably have to look towards the unemployment insurance system, again, the pandemic unemployment assistance. They may be able to, again, go back to their employer now that the Families First provisions have gone into effect and request again that that they are covered, unless they again are exempted because they work for a business that has 500 or more employees, or they're a small business that has asked for an exemption for the Department of Labor. They may be able to go back and request this paid leave.
Okay, great. And I'm just going to ask one more question, and then we're going to move on. So we got a couple people that just want to know like what their options are if they don't fit within that very narrow employee number. You know, they're above that or below that, or a federal employee. Are there any options currently available to those folks?
So the only real options, if they if they are working for an employer with more than 500 employees, they are not covered. Again, they should ask. We recommend employees asking their employers, because even if an employer isn't covered by the federal policy, we're hoping that some employers that employers will do the right thing. I mean, nobody wants workers to come to work sick and continue to pass contagion along, and more importantly, that they should be able to heal and get better themselves or care for their family member. If they ask their employer and they don't get the paid emergency paid sick day or emergency paid leave, they can go and see if it's provided by their state, because again, some of the states have paid sick days, and some states have actually adopted emergency paid sick days laws and extended emergency paid leave policies. So they could check with their state to see if they're covered by their state. And if they're not covered by their state or locality, because many localities also have paid sick days laws, then again, they have the unemployment insurance system.
Okay, great. So thank you so much, Pranita. That was excellent. I just wanted to remind everyone that we're going to try to get to as many of your questions as possible after the webinar. There's a lot of really excellent questions, and we know that we're only getting to 4 or 5 of them during the chat itself. So we're going to try to capture those. We'll provide them to you after the webinar in the documents that we're sending, and then we're also going to have those materials up on the blog too. So next, we're going to hear from Crystal Fitzsimmons from the Food Research and Action Center, who will help walk us through how you can apply for nutrition assistance and some of the changes that have been made in recent legislation. Thanks so much, Crystal. I think you're on mute, Crystal.
Okay.
There you go.
Mute anymore. And now I'm going to share my screen. Hi, everybody. I just want to start by thanking Moms Rising. Moms Rising has shown tremendous leadership and been an amazing partner working on hunger and nutrition since I've been at FRAC. So we really appreciate the partnership, and we really appreciate all the great work that Alyssa does all the time in DC with us. I just wanted to start by talking about the federal nutrition program. So in a lot of ways, we are really, really lucky to have a strong nutrition safety net for people. It's not perfect, and there are definitely lots of things that we could do to improve it. And FRAC spends a lot of time working to try and make it better and make it reach more children and more families and more individuals. But it does provide a pretty solid foundation. And one of the most amazing things about the federal nutrition programs is that all of them, except for WIC, are really designed to meet any increase in need. So if more families become eligible for SNAP, or if more families become eligible for free or reduced price school meals, those programs automatically respond and provide benefits or provide free or reduced price school lunch to the families who are now eligible. So it's a pretty amazing system. It's not perfect, but it does provide a pretty solid base for combating hunger and improving nutrition in this country. So needless to say, when states across the country started closing their schools, that meant that about 22 million kids who rely on free or reduced price school breakfast and lunch on an average school day actually lost access to those meals. So one of the things that Congress decided to do, which we worked very hard on and were very supportive of, was when they passed the Families First Coronavirus Response Act, they actually created a new program called Pandemic EBT. And the idea is to provide an EBT card with a value on it to families whose children were receiving free or reduced price meals at school to be able to purchase that nutrition and replace that loss of nutrition that a lot of families rely on to make ends meet. And so the value of the EBT card really is about providing the free reimbursement rate for lunch and breakfast. So it works out to be $5.70 per day in most states, and that works out to be about $114 per child for 4 weeks. So you can see it's a pretty important resource that families will be able to access to help support nutrition in the household and make sure that they're keeping hunger at bay. So who's eligible for this new benefit? All the kids who have been certified for free or reduced price school meals are eligible for this benefit. Kids who attend schools that offer free meals to all students, so that includes schools that are operating under the community eligibility provision or provision 2 or 3. But if the school is providing free lunch to all students, then those families who attend the school will be eligible. And the third group that I want to point out that I think we have to do a lot of thinking about and making sure that families are able to access it, but it's the newly eligible families, the families who have lost their jobs, who have had their wages reduced, who are really being impacted by the economic impacts of the coronavirus, and we need to be making sure and figuring out processes to make sure those families are able to access those benefits as well. So there is no requirement that states participate in pandemic EBT. In order for states to provide these benefits, the state has to develop a plan and get it approved by USDA. The plan really has to explain how they're going to operate the program, how they're going to identify eligible kids and families, how they're going to distribute those benefits. But they have to submit a plan in order for families in their state to receive those benefits. And if you're really interested in digging into the weeds on it, USDA has issued guidance on this and an FAQ on it, which you can definitely dig into more. I'm gonna keep this a little more high level though. So how do I get pandemic EBT benefits if I need them? Well, first, and the easiest thing for states to do is actually to provide them to the households who are participating in SNAP. SNAP households are automatically eligible for free school meals. They're directly certified for them, and it's really easy for states to kind of plus up the benefits that a SNAP household would receive on their SNAP EBT card. The harder groups of kids are the kids who are not in a SNAP household. So states really do have to figure out a way to identify the kids who are certified for free reduced price meals and bring them into pandemic EBT. And some states like Michigan and Rhode Island, they have really strong state databases of students who are eligible, and they're able to actually share that information, and it should be somewhat seamless for most of the families. In some states, there may be a requirement to kind of submit a simple form so that your child can be matched to their eligibility, and then you can receive the benefits. And then the third group is the newly eligible that I mentioned earlier. In order for those families to receive this benefit, they really do need to apply for SNAP, which I think is an important resource for families to access anyway if they're eligible, or they need to go ahead and apply for free or reduced price school meals. A lot of schools have a free or reduced price school meal application online that families can access. But if that is not available, you can also call your school district and ask them how you can apply. Because if you want to receive pandemic EBT, you either need to have been certified before the school shut down, or we need to get you into these programs. So far, we actually have had 6 states submit their plans and get them approved. So if you're in Arizona, Illinois, Massachusetts, Michigan, North Carolina, Rhode Island, your state is on the ball. You guys got your plans in and USDA approved them, and benefits should be coming out, relatively soon to families. We have about another 15 states who have submitted applications and submitted their plans to USDA that have not been approved yet. But one of the things that we're doing as advocates is to try and encourage all states to apply for plans and to set them up so that families can as seamlessly and as easily as possible access these benefits. So in addition to pandemic EBT, we've been able to fall back on the nutrition programs as they stand because there is some flexibility there. So the summer nutrition programs, which schools can operate and local government agencies like Parks and Rec agencies or county health departments, or local nonprofits like food banks and YMCAs and Boys and Girls Clubs, those summer nutrition programs actually can start to operate when there's an unanticipated school closure. So normally they operate during the summer, but they're within the statute, they actually are allowed to begin operating. So if there are meal sites in your community, they're probably providing them through the summer nutrition programs. And it's really important to also note that these programs can operate alongside pandemic EBT. You know, we know that not all states have submitted their plans, and there is going to be a bit of a lag before families receive these benefits, which I think speaks to the importance of making sure that we have these meal sites where families can get access to the school meals basically that they would have received if their kids were able to go into the cafeteria right now. So in addition to how the programs normally operate, when Congress passed the Families First Coronavirus Response Act, it just kind of rolls off your tongue. They included provisions that gave USDA more authority to waive program rules and also to create nationwide waivers to make it easier. So one of the first things they really did was to get rid of this non-congregate feeding requirement, which I know is kind of a weird term, but it's basically what happens when kids come into the cafeteria or at a Parks and Rec site getting a meal, they're congregating together and they're eating together. Well, obviously that doesn't make any sense if you're trying to social distance. So they got rid of that requirement. They got rid of the area eligibility requirement in states. Most states applied for a state waiver, and so there's more flexibility to open up summer feeding sites in a variety of areas across the state. They also allowed multiple meals to be served, so sites can actually provide up to 5 days worth of meals, which is something we really are encouraging people to do because we think it makes life a lot easier for the families who are trying to access this resource, as well as for the schools and nonprofits who are providing those meals. There's also flexibility in meal service times, and if there's a disruption in some of the food that needs to be included in the nutrition in the meals, because there are nutrition standards for these meals that are provided through the summer nutrition programs, there is some flexibility there if sponsors are having a hard time getting specific items within those nutrition requirements. And the last piece is we have the after-school supper and snack programs, and generally those required some kind of enrichment activities, and USDA actually waived that. So those can be offered without any enrichment activities as non-congregate sites. And schools that were running after-school suppers and school meals could actually provide breakfast, lunch, and a supper for 5 days and make it really easy for families to access the nutrition that they need. And so we are encouraging, and hopefully some people on the webinar tonight are seeing this happen in their communities, but we're really encouraging people to make sure that they're have sites throughout the community that people can access. Some communities are actually utilizing bus routes and having sites where the bus would normally stop to pick up kids to make it easier for families to access it, because we know that transportation can be a barrier and it can be a huge pain to carry 5 days worth of breakfast and 5 days worth of lunches home to your house for 2 or 3 children, or even just one. So we're encouraging people to think about that. There's also flexibility to even deliver meals directly to kids' homes who need access to them. And there's a lot of really wonderful partnerships that are happening across the country. I'm not going to spend time talking about emergency food and food banks, but they are partnering with a lot of these sites, and sometimes they're providing additional food or other resources to families. There's a lot of creative thinking about how do we leverage different resources within the community in order to make sure that kids have access to meals. So it has been really amazing to see all the different players within communities come together to try and make sure that the kids are not going hungry and continue to have access to the meals that they rely on when school is open. And so if you want to identify where a site is, USDA has this really cool Find Meals for Kids mapper, and I have the website link on the side of the PowerPoint, so you can click on that and go there. But just to kind of demonstrate what happens, I went ahead and entered an address that was close to my house, and these are the sites that are as close as possible. So you can see they're not super close. It would be kind of hard for me to walk to these sites, which I think speaks to the importance of, you know, thinking about the transportation barriers and how to overcome them in your community, but also pandemic EBT as well. And hopefully if you punch in your address, you will find some sites a little bit closer to you. But I live in Washington, D.C., which is a pretty urban area, so I would have thought I would have been able to find a site a lot more closer. But speaking to that, I also wanted to share another resource that I think might be helpful to some people, because sometimes if you actually go to the state level, you can actually get more detailed information about sites. So this map is a map that we have up on FRAC's website, and it'll drive you, if you click on your state, it'll take you to your state's resources on COVID-19, the child nutrition resources. And a lot of states actually list sites, and they may be more up to date than the federal list. So I would encourage you, if you go on the USDA website and you don't find a site that's close to your house, you might want to take a look at our map as well and see if you can find something a little bit closer. And then I also just wanted to flag two other programs that are available. They were available before COVID-19. They will remain available after COVID-19, but they are a resource available to families all the time, and families who have become eligible. And the first one is WIC. This is a beloved program which really does help improve the health and well-being of our pregnant women and young mothers and young children up to the age of 5 on their birthday, and it provides nutritious food and nutrition education and access to healthcare. So families can definitely continue to apply to that. There is the 1-800 toll-free number to get more information, and then I also included USDA's website with the state WIC contacts if you want to follow up with them as well. And then SNAP is one of our, biggest child nutrition programs, serving millions of kids across the country. And it really plays a critical role in improving health and well-being and reducing hunger. And it provides benefits to eligible families to purchase food and using an EBT card. And if you are interested in applying for that, I included USDA's website, which has links to all the state SNAP pages. And I went ahead and clicked on Texas, even though I'm not in Texas. And you can see that it pops up and you can click onto an online application. There's some phone numbers that you can follow up with. So there's some resources if you're interested in applying for SNAP to help you get there. And I just wanted to close out with a couple resources that FRAC has. We have a summary of pandemic EBT if you want to read more about it. We are keeping a web page up to date, and you'd be surprised at how often we actually have to update our resources, because a lot of times things are moving. Hopefully we keep hearing more states are getting approved for pandemic EBT. USDA is sometimes allowing more flexibility for the meal program. So we keep updating it and try to keep the resources as up to date as possible. But if you want to dig in a little bit more, there's links to those. And if you want to hook up with FRAC in any way, there's our social media channels for anybody to grab onto.
Great, thank you so much, Crystal. So I'm going to go over a couple of questions that we got. We got a number of questions from people whose children are not in elementary school or higher, so not K through 12, but are in daycares or Head Start, where they may have offered free meals and snacks, but like Head Start or the family daycare is closed. So are they eligible for the pandemic EBT?
So at this point, they are not eligible for the pandemic EBT. There is talk in Congress about expanding it to allow families that are relying on CACFP to come into the program. So we are hopeful that if they pass another package that actually addresses families' needs, that this will be included and they will expand it. The other thing that we're hoping that they'll do with pandemic EBT is technically the way it's written now is that it only runs until your school would have officially closed for summer. And we are actually hopeful that Congress will extend that through the summer because we think that we're probably going to be social distancing through the summer. We think that families need access to that benefit. So those are two different advocacy pieces that we're hoping Congress will act on.
And just as a reminder to folks, CACFP is the program that if your child is getting free meals or snacks in their childcare setting, that's the program. You might not actually know the name of it because you just know that your kid gets, free milk and snacks and stuff, but that's the program. Can we just review one more time the list of states who have already submitted and gotten their plans approved? And then people are wondering, how are they going to know if their state, like where their state is in the process, if they've submitted a plan, if it got approved, how are they going to be notified?
So there is some press that's been happening when states have been announced. So you can see there's the 6 states that have been approved. States are required to do communications out to families to let them know. And then we work with a network of anti-hunger advocates across the country. I saw a couple of them actually on the webinar who are probably going to be helping with outreach as well. We'll be doing some outreach. We're talking to some of our national partners about getting the word out. So there's going to be some pretty aggressive pushes to get information out about these programs, and states are required to notify families about this. So, so that is how you will know. USDA has been announcing it slowly, which I think is good because then the states can actually move once they get approved. But like they just announced Arizona and Illinois, was it this morning or yesterday? The days seem to be blurring together for me. Either this morning or yesterday, they announced Arizona and Illinois. So they keep adding more states. We will be keeping this list updated on our website, so you can definitely check our website out. And we'll definitely communicate with Alyssa too and make sure that she's pushing it out through Moms Rising.
And just one more, someone did ask about senior programs. We're going to provide that in the follow-up because there's a number of programs that seniors can access, and we'll also provide some more information on what's happening with WIC. But we did get a question which kind of will help us bridge into Jackie's presentation about undocumented immigrants and if they could access WIC or SNAP or the emergency, the pandemic EBT. So maybe.
Yeah, so I could pass it to Jackie for everything. The pandemic EBT is designed for kids who participate in school meals. Any child who's enrolled at a school can participate in free or reduced price school meals. So that is how the eligibility is designed, but that is a perfect transition to Jackie.
Great. And then normally with WIC and SNAP?
Well, so I'll let Jackie dig into that a little bit. But I did just want to flag with seniors. Seniors often are eligible for SNAP and should consider applying. And one of the other things that we actually, another advocacy piece that we're looking at is trying to get Congress to increase the minimum benefit, because a lot of seniors get the minimum benefit for SNAP, which is $16 per month. We're trying to encourage Congress to bump that up to $30 a month. But that is an important resource for seniors as well.
Okay, great. Thanks so much, Crystal.
Mm-hmm.
So we teased it, but our last presenter tonight is going to be Jackie Vimo from the National Immigration Law Center. And she's going to walk us through how immigrant families are impacted by the new COVID-19 programs. I think you might be muted, Jackie. Oh, there you no. Are you ready?
Did you switch up to phone audio on your computer, Jackie?
Can you hear me now?
Yes.
Okay, this happened to me actually at a webinar earlier this week twice. My computer decides to crash for no particular reason while I am in the middle of giving a presentation. I'm gonna try and share my screen and hope that it works. And I now have to do this on the phone. Can you all see my screen right now?
Yes.
Okay, thank goodness. All right, great. Well, there's a lot to cover, and I am going to try and do it sort of quickly and just sort of hope that folks, you know, can do this, can sort of follow up with questions. But I'm going to talk a little bit about sort of three main buckets of programs that are.
I think we lost you, Jackie.
I guess you can't hear me unless I hold this up, so we're going to have to do it on the phone. Okay. So I'm going to talk about healthcare. I'm going to talk about unemployment insurance and cash assistance, and I'm going to talk about food and nutrition programs. So for healthcare, I mean, first of all, I think the most important thing to mention is we're in the middle of a pandemic. And, you know, it's really crucial for folks to know that everyone has a right to access healthcare regardless of their immigration status, and that, you know, these are matters of life and death. And, you know, we really want to be encouraging people to access care. The other piece is that I think is really important to note is that there is no public charge. There are no public charge concerns for COVID-19. The U.S. Citizenship and Immigration Services have announced that there's, I don't know why my computer's doing this, I'm so sorry, that there's no, there's not going to be, there will not be considering any types of testing, treatment, or preventive services for COVID-19 as part of a public charge analysis. Next, ICE has announced that there will be no enforcement at health centers for people accessing treatment for COVID-19. So that's an important thing to note. And this is actually part of a long-standing policy that that DHS has had, the Department of Homeland Security, where they have committed to not conducting enforcement activities at hospitals, schools, places of worship, funerals, weddings, and demonstrations. Of course, every time I give this presentation, someone says, wait a second, I read a story about a family at the border where someone did an action at a hospital. It's ICE and it's DHS, and they have not been the most reliable actors. However, it has been months and months. The issues about enforcement in hospitals have only happened a handful of times. It has not happened for a really long time, and you know, we really feel confident that at this point that is not something that people need to be concerned about. Okay, so that's healthcare. I think the other thing to note is that, oops, there we go. That no one should be denying themselves or their family members health care during COVID-19. There's no public charge test for accessing COVID-19 testing, treatment, and care. ICE is not engaging in immigration enforcement activities in places where people get care. That said, there are no specific programs for uninsured immigrants in the CARES Act or in other relief acts. So when people talk about, oh, well, this is so great, the CARES Act is providing treatment and care for everyone, that's only if you're in Medicaid or you're in an ACA-approved health program. And so we are hearing terrible stories about immigrants going to hospitals to get care. And they say, ah, sure, you can get care, and you're going to end up with a $100,000 health bill. And so what we're really recommending is there are places that federally qualified health centers and clinics where immigrants can get low-cost care, and that existed prior to COVID-19. I mean, it's outrageous that they haven't made a provision that guarantees free care and treatment for everyone. Unfortunately, they haven't if you're an immigrant and you're uninsured. Again, the other thing to note is that use of healthcare by family members is not considered as part of a public charge determination, because a lot of the things that people always talk about is, well, what happens if my kid is eligible for Medicaid? Can they get it? And again, it shouldn't count for anyone, but also a reminder that it does not count if your children or other family members use it. Okay, so unemployment and the CARES Act. So what happens if you've been laid off, if you're suffering economic challenges during this terrible both public health crisis and also economic crisis that we've been having? The long story short, when it comes to, unfortunately, the CARE Act and sort of unemployment insurance more broadly, is that in order to claim unemployment insurance, immigrants must have had work authorization, one, during the base period that they're filing for the UI claim, two, at the time that they're filing for the claim, and be ready, willing, and able to work. So what that means is they have to have work authorization at that time. So basically, if you do not have work authorization, if you are undocumented, if you are here on a visa where you don't have work authorization, you cannot get unemployment insurance. There are no additional types of restrictions for family and medical leave, paid leave. But again, they presume work authorization at the time that you were working. And so that's why really states have really need to step in to fill the gap in terms of addressing unemployed immigrant workers. Okay, so the other issue that we haven't really talked too much about is the economic impact statements. I don't know, it's the EAPs, as I call them. There are three major requirements. Sorry about the typo, there should be EIP. One is you're supposed to have a valid social security number. Again, so that's going to, and I'm going to get into that a little bit more. Two, you cannot, I don't know what is going on with my computer, but you cannot, sorry, you could not be claimed as a dependent of another taxpayer. So for example, if you are eligible, but you still live with your parents, you cannot get the EIP. You have to have adjusted gross income under certain limits. And this is something that people are asking a lot of questions about. You have to be a US citizen or what's called a US citizen or a green card or a resident alien. And basically what resident alien means is that you live in the US. So I think that for the most part, unless you're someone who doesn't live in the United States and hasn't lived here this year, you don't have to worry about that part. That's also a different word in immigration law, and it's confused a lot of people. But basically, long story short is you just have to have lived in the United States. Okay, so as a reminder, I don't know why this flipped it around. The EIP, sorry about that, is an advance rebate on the fiscal year 2020 taxes. So that means that they're advancing you what they presume is going to be something to help you out for the economic harm you're going to be experiencing next year. Again, the maximum rebate is $1,200 for individuals, $2,400 for taxpayers filing jointly, and $500 per qualifying child. Now, back to the Social Security number requirement. This is all well and good, assuming a world where everyone lives in families where everyone has the same status. Unfortunately, this means, of course, that if everyone in the family has does not have a Social Security number, that no one in the family can get access to these earned income payments. Some people are calling them COVID relief checks. Some people are calling them, crisis checks. They have lots of different names. The name that the IRS is calling them is again, economic impact payments, like I like to say, EAP. So basically, the way that it works for the Social Security number requirement, and this is very complicated, and I can get into different scenarios, is that one, so if you are a couple that is filing jointly, and let's say your spouse, you have a Social Security number, but your spouse has an ITIN, if you're filing jointly, no one in the family can get the return, unless one of the spouses filing jointly was in the armed forces last tax year, and one of the spouses has a valid Social Security number. So again, there's a carve out for military families, but only certain military families. That's only if you were in last year. It does not help you if there was a vet For example, there was a veteran that served prior to last year. That's not going to help them, and they have a spouse who does not have a Social Security number. In addition, children who are claimed as dependents for the $500 rebate must have a valid Social Security number or an adoption taxpayer identification number. So let's say, again, so 2 taxpayers, both of them have a Social Security number, and they have 1 kid with a social, 1 kid with an ITIN. They can each get the EAP, and then they can get $500, but only for the kid that has a Social Security number. If they are mixed status, and they are filing jointly, and one has a social and the other one has an ITIN, then no one can get it. They could theoretically get the benefit if they filed separately, but honestly, that's not something we can recommend, because if you file separately, you lose the Affordable Care Act credit. You lose a whole bunch of other child tax credits, family credits. Talk to a tax professional, but for the most part, it's not going to be a workaround to file separately. Okay, so how do they get issued? Again, this is an issue that a lot of immigrants get concerned about as well. That is sort of a more general issue, is that for the most cases, a rebate is issued automatically, right? So if you file taxes in 2018 or 2019, you already filed your 2019 taxes. I personally have not done so yet. If you have, congratulations, you're way ahead of where I am. The payments are going to be issued on the last tax return that you filed. Again, so you might have been eligible back in 2018 and you're not now. You don't have to worry about that, because they're just going to give it to you as an advance. Again, then there's this whole other issue that, again, I can answer specific questions about, but it's very complicated. And actually, while we were on the webinar, things changed because that's how things are going right now. You will receive it automatically. And I don't know if folks followed the news a few weeks ago about the concerns about people who are retirees. I know my in-laws and my parents don't have any income. They only receive Social Security retirement. They haven't had to file taxes for a long time because they don't make any money, and you're not required to file taxes when you don't make any money. The IRS has clarified that if you receive Social Security retirement, if you receive Social Security disability, if you receive railroad retirement benefits, or supplemental security income, SSI, then you do not need to file taxes. They will do that automatically. That was a big fight because there was some bad news. You might have heard my mother-in-law was calling me saying, wait a second, I read the news and it said that I have to file taxes. No, that changed. If you're retired, you do not have to file taxes. However, as of this afternoon, it turns out that if you receive one of these benefits and want to claim a dependent, so like let's say you're a grandmother and you've been claiming your grandchild who's been taken care of on your taxes, now suddenly, again, oh, I'm sorry about the typo here. This was written 10 minutes ago because it just happened. You will need to revisit the portal by April 22nd. That is, for those of you not looking at a calendar, that is tomorrow. And it's outrageous. But again, if you're a grandparent and you have disability and you have Social Security retirement, and you have a kid that you claim as a dependent, a child that you claim as a dependent, or another person you claim as a dependent, you have to actually go to the portal, which I'll talk about, by April 22nd. And then, again, which is very unfair, if it ends up being that you didn't have time to go by tomorrow, you will be able to get it at a later time when they fix your taxes for 2020. But it's really an unfortunate extra step that they're burdening, retirees with. And then as of today, according to the IRS website, immigrants that are not green card holders or citizens, it seems like need to file their taxes in order to receive the EIP, even if they did not earn enough in order to make that, which again is really unfortunate and is an extra step. But the long story short is the majority of people, if you file taxes, will get it in 2018 or 2019. If you receive one of these programs, you will get it automatically unless you have a dependent. Okay, and this is the portal for non-filers. Okay, so if you have not filed taxes in a long time and you do not receive one of those benefits I mentioned, you go to irs.gov/EIP. Again, that's for anyone who didn't file taxes in 2018 and 2019, did not make more than $12,200, and we're not otherwise required to file a tax return. I think a lot of people are very concerned about what happens if, let's say I earned very little in 2018 and 2019, and then in 2020 I hit the jackpot, and suddenly I make a ton of money. Do I have to repay that if they give me advance? You are not required to repay, so you're just very lucky if you made less and now you make more. Okay. Just a final note, and we are going way over here. There are no public charge consequences for these tax rebates. They are not considered as part of the public charge test. If you need help with these taxes, you can visit either the volunteer income tax assistance sites or tax counseling for the elderly sites. However, as folks probably guessed, those are closed right now for the most part. So you can go to this website and call to find out about help. Okay, the top lines is that the virus doesn't exclude anyone based on immigration status, and this relief bill should not be punishing people simply because they are married to or have family members who do not have social security numbers. And you know, we really need to sort of be getting the word out. Okay, finally, food and nutrition programs. Crystal talked a lot about SNAP. This is unfortunately only for qualified immigrants. So you have to either be a US citizen or a green card holder who's been in the US for more than 5 years, except for these provisions. However, there are programs without immigration status requirements, and that includes food pantries and meal sites, child nutrition programs, and school meals. So if there is a PEBT, you know, that it rolls out, then when there is a PEBT program, then you should be able to claim that for your child who was participating or eligible for a school meal. And WIC has no immigration restrictions as well. Again, the final note to remember is the vast majority of non-citizens who are eligible to participate in things like SNAP are not subject to public charge, because as we remembered, public charge is something for people who have, who are applying for a green card. And in order to get SNAP, you usually have to have a green card and be here for 5 years already. Reminder that using one of these programs, if your family falls on hard times and someone does use SNAP, that doesn't make the person automatically a public charge. If your family members are eligible for public charge, but a person who's applying for green card isn't, that's not going to impact them. And as a reminder, there are a number of different programs that are not subject to public charge. So again, no one should go hungry during the COVID-19 epidemic, and we should be pushing Congress to eliminate immigration status restrictions. Okay, and with that, I am done with my very long presentation. Thank you.
Thank you, Jackie. That was great. So I'm going to go over a couple of questions that we got. One was from Ruth, who said that she works with farm workers in the Central Valley, and they're undocumented but have been laid off. Can they apply for any benefits out there? And if so, which benefits?
Yeah, if you're undocumented, you are not eligible for unemployment insurance, unfortunately. If they are, but you're saying in the Central Valley, is that right?
Yeah. So
yeah, okay, well, this is California. So in California, the great land of golden opportunity for immigrants, there are some programs that are now, becoming available. Unfortunately, nothing federally for those workers, but if you're lucky enough to live in California, there are some programs. I'm happy to share them in the chat again, but that's only for people who are residents of California. So there are some programs indeed in California, but nothing federal.
If their children were getting free school lunches, they should be able to continue.
Yes, they should be able to get either access them, and then also they will be able to get the PEBT cards that might be coming in the mail. So every state has to determine how they're going to be giving out these different resources. In some cases, someone might already have an EBT card and they might just load on those benefits onto that card already. But if you're an undocumented immigrant, and then you're not going to have an EBT card, and you'd be very scared if you suddenly get an EBT card in the mail. So there's going to have to be a lot of public education that's going to have to happen to educate folks about, that it's safe for them to use this benefit.
Gotcha. And then, so we've gotten a lot of questions about who is eligible for the rebate direct assistance and who's not. Maybe we could review that real quickly, but one specific question that I saw a couple times was, if the parents both have social security numbers and file jointly, but it's the child that doesn't, which is the reverse of what we hear about a lot of the time, will they just not get the $500 for the child, or will they not get anything?
So, sorry, if the two parents have ITINs, is that the question?
No, the parents have social securities, but
yes.
the child is basically, the child is undocumented. I mean, not a scenario you hear as much about.
It's a rare scenario, but that's right. So they'll each get the $1,200 themselves, but they will get nothing for the child, because in order to, the qualifying child has to have a social. But that doesn't mean the whole family will be ineligible. Okay. No.
I mean, can we just go over real quickly again, because I think we went through it fast, so maybe it's a little slower.
Sorry, it was my screen was all sort of frozen. Is
just who can get those, let's do it this way. Who can't get those rebate checks? Who's ineligible?
Yep, so basically if you're joint filing and both of the people on your tax return do not have a social security number, you cannot get it. If you are filing separately and you do not have a social security number, you cannot get it. That's basically, and even if you didn't live in the United States, you cannot get it. But other than that, you're gonna get it, and you're gonna probably get it automatically. If you didn't file taxes at all, and you receive one of the benefits I mentioned, Social Security, retirement, SSDI or SSEI or railroad benefits, you will get it automatically. However, if you did not get one of those benefits, then you have to go to the portal, the irs.gov/EIP, and then you're going to have to just enter basic information in order to get it. So if you file taxes, you pretty much don't have to worry about it. That's basically the long story short there.
Okay. And then Efron wants to know if they have a work permit and are self-employed, do we still qualify for unemployment? Can they get either like pandemic unemployment is probably what they would qualify for, but they have a work permit.
Sorry. So the question is sort of you have a work. So if you have a work permit, your eligibility is the same as anyone else's. Sort of. The long story short with SS, and I think there's another thing to mention that a lot of people are very confused about is if you have DACA and that means you have a social security number. And if you have a social security number and you've been given it once in your life, you are going to have that for the rest of your life. You never go back, even if you lose your work authorization, you never go back to filing with an ITIN. And then secondarily, if you have DACA, that for the most part is going to mean, unless you lost your DACA status, that you have work authorization. So if you have DACA and you still have DACA, you're eligible for all these programs. You're eligible for UI, you're eligible for the EIP, you're eligible for all those things. And then similarly, if you are, you have TPS, and then you have a social security number and you have work authorization, you're also eligible. There's been a lot of really bad information out there saying that people with DACA are not eligible for these programs, and that's not true.
Great. And then one last question that has to do with public charge. So if an immigrant joined Medicaid in order to get COVID treatment, but had previously left Medicaid because of public charge consideration, will it be, and this probably can go for any program that's in public charge, will it be counted for public charge post-coronavirus?
Right. So again, USCIS has made it very clear that that people who are accessing treatment and care for public charge for COVID-19 are not subject to public charge. But also, if that person had Medicaid before, then except for in like 3 cases, that person already has a green card and has been here for 5 years. So that person doesn't have to worry about public charge. So I can get into specifics about that person's case, but again, to be eligible for Medicaid, you have to have already had your green card, and public charge only comes up when you're applying for your green card. It does not come up when you're applying for citizenship. The only issue that could come up is if you leave the country for more than 180 days and you have a green card. But even then, it's really just most people who are eligible for Medicaid do not have to worry about public charge, unless they leave the country for a while, and then they should talk to an attorney. But for the most part, it's not an issue.
And then just one more question that we just got in that has to do with how DACA renewals are taking longer due to this pandemic. So people are in limbo. So she just wants to confirm, will people with DACA and TPS only be eligible so long as they have their EAC valid?
So yeah, I mean, that's the problem. If they are, if they are applying for unemployment insurance, they have to have work authorization at the time that they are applying and be ready, willing, and able to work. So unfortunately for UI, they won't be eligible. The tough issue is if someone is getting a payment, like they say they get the EIP, it's going to be based on the 2018 and 2019 tax returns if they've already filed, at which point they would have had their work authorization. So then what happens if they lose it in 2020 and they already got paid automatically? Our analysis is that they just get to keep the money. That was IRS's error. They didn't affirmatively do that, so they shouldn't be concerned about that. But of course, we have a larger issue, which is that we have a Supreme Court that could make a decision as early as Thursday, about the DACA program. So I think there's a lot of unknowns there right now, unfortunately.
Okay, great. Thank you so much, Jackie. We got a lot of questions about the direct payments, and we actually weren't addressing that as much on this webinar.
Sorry.
No, we talked about it as it referred to immigration status because that's really important. And at Moms Rising, we've been hearing a lot from people with those questions. We are working with an organization on a frequently asked question document that refers to all people living in the country, not just immigrants, but people who are waiting to get their check, who's eligible, at what age does your child have to be in order to get the bonus money. So we're going to hopefully have that up on our blog soon. We'll make sure that's in the resource guide, and if it makes sense, we could possibly do another webinar just on the direct payment, stimulus check pieces. But we saw your questions and we just wanted to address that. But yeah, so I think that we're wrapping up. I just wanted to thank everyone, Michelle, Pronita, Crystal, and Jackie for an excellent conversation and for sharing the vital information tonight. As I've mentioned before, we are recording this, so we will send the recording around with the resource guide in the coming days. We are also planning on creating a recording version of this that has subtitles in Spanish in it. So those that were on the translation line will be able to share this and go back and look at it. And once you receive that video recording, we'll have it sent to you, but also up on our Facebook page and Moms Rising's blog at www.MomsRising.org. And you should feel free to share that information far and wide. The other thing that we're really interested in hearing about are your experiences and stories during the pandemic. So if you're comfortable, please share your story with Moms Rising. I'm gonna drop the link into the chat box, and that's where you can go to share your story with us. Or any experiences that you've been having. You could also submit your story anonymously. We promise that we will not share your information with anyone if you want it to be anonymous. And also, if you have follow-up questions, you can reach out to us at keepmarching@momsrising.org. I'm also dropping that email address into the chat box, and we'll get back to either me or Joy or Gloria, who've been so amazing in helping us set up this webinar tonight. And just as I mentioned, we will be answering the questions that you all have sent in that we haven't had a chance to get to. We'll do it in our after webinar resources, and we'll also have that up on our blog. And just so you don't panic and wonder where it is, it's going to take us a little while. Could possibly take us a week just to get all this information together and the recording of the webinar. So just keep an eye out on your inbox, and we'll also have all the resources up on our blog. But we just want to thank all of you for joining us tonight. We know it was a lot of information, but we hope that it was helpful to you. And thank you again to our speakers. Have a good night.